What they say, Freddie. Welcome back, everybody, to our monthly Holistic Actions Q&As, where this month of Thanksgiving yesterday, we're full of gratitude for you all being here and wanting to do this with your animals. And I'm Jeff Feinman. That's Dr. Christina Shambro, and we're here to answer questions reframed with the Path to Pet Wellness framework, which basically is a homeopathic framework where we are focusing on balance instead of symptoms. So, when we get going, talk a little more about what that means, but I think anyone can raise their hand just by clicking the react button at the bottom and raising your hand. Or like Ruth just did, just post in the chat if you have any questions. So
Or go like this and we might see you.
that'll work too. Yeah. Hello, Linda.
When
We
somebody
see you.
stops speaking and you know there's a blank, then you can go like this if you need. So I also want to just really express my gratitude for Dr. Jeff starting this group 8 years ago or so, and continuing to look for how can we do it better? How can we have each of you be ambassadors that are members of Holistic Actions, and then opening it to people who, having this once a month to people who aren't members. So that's it. If when you ask your question, if you would just say, I'm a Holistic Action member, and then ask your question. Um, because if you are a member, I may mention things anyway, but Holistic Actions has incredible amount of resources that we can direct you to if you're a member. And most importantly, as Dr. Jeff said, we're focused on balance. And we're not ignoring symptoms, we're using symptoms as clues. But on this question and answer, I will guarantee you that while we will give you suggestions for the symptoms that are bothering you and your animal, our our one main thing is to restore balance. And when that happens, the body naturally gets rid of the symptoms and the symptoms stay away. And then your animal lives a longer, healthier life in general. So you're going to hear that repeated, but it's good to know that just keep that in the back of your mind as you're thinking about problems or questions you have. So we'll start. Go ahead, Linda.
Oh, okay. Thank you. So happy to be here. And I am not a member. I would love to be a member, but I've had some issues. I've been chronically ill for a long time, and I'm having some financial issues. But I'm so glad that you're offering this. And my question is, since I got sick, my cat has gotten sick. She became hypersensitive to fleas, and I've been working now that I am a little more higher functioning, I've been getting better, and I've been trying to do it naturally and restore balance to her health. But I am just beside myself. I have not been able to conquer the fleas. When I comb her now, I can't find a flea on her, yet there must be a flea on her because she is still reacting to it. So, would it be the
Well,
worst thing in
a,
the
a
world?
couple of things. One is, um, yes, one bite can trigger them, but how long have you gone with seeing no fleas when you've been flea combing her? A week, 2 weeks, 3 weeks?
A couple weeks.
Okay, if you've not seen a flea on her for a couple of weeks, this might not be directly due to fleas. Okay, because cats have skin problems. Cats have an imbalance in their vital force, their energy field.
Hmm.
And when they're healthy enough, they will create symptoms on the skin, as opposed to liver disease, bladder disease, things like that. So we applaud while you're struggling a bit with seeing itching happening or licking over grooming, it be grateful every time you see it. because your mindset does affect her, of course, as you noticed.
I know.
And so just go, yes, it's still on the skin. Yes, it's still on the skin, and just keep doing that. That is step one. Okay.
Well, oh, I have been doing that because I have been listening to you both
Okay.
before. And but she's still scratching
Well, yeah.
and she's
And
still
there are multiple things.
biting. You know,
Yeah, so there is no one right, there's no magic answer, number one, other than drugs, which stop things temporarily. And I know you don't want to do that. There's nothing holistic that's magic to stop it. So the things you need to start working on is, have you taken the 101 course that's for free?
no, I want to do that.
Okay, just break, it's 5 lessons, and you can break each lesson down into pieces. So, with whatever energy you have available to do that,
Mhm.
take the time to do that. That's going to give you a huge amount of keys to
Okay.
relieve the skin itching. Okay, so number one is, what kind of food are you feeding? Dry food, canned food,
That's
fresh
another
food?
thing. I've been trying to change her food, thinking that that would help. And so I've been trying to go to raw, but she won't eat raw, so I bought raw, but I'm cooking it a little, very
Mhm.
gently cooking it.
So again, there's no one right answer. It does
Uh-huh.
not have to be raw. Right
Okay,
now, fresh is
fresh.
what you want, okay? And
Uh-huh.
if she'll eat fresh cooked, then that's going to be better.
Okay, but here's my question. Should it be like fresh, just plain meat from the store, or should
So
it be
actually,
what they
yep,
make for cats? They
nope, you can get it just from the store. Save your money. Okay. However, you do need to learn a few things.
okay.
So here's what you need to take the 101 course, because we don't have, it would take me an hour to coach you on everything you need to know to
Okay.
be able to feed fresh food.
Okay.
The second thing that you might want to do, so lesson two is on feeding. And the second is, there are many free articles at Dr. Hovey's site. She's one of our veterinarians, littlebigcat.com.
Okay.
And on our site, on Holistic Actions, for free, you can go to the forum and read what people have said about feeding their cats.
Okay.
Okay? You don't have to pay for that. You can't post. If you're a member, you can post.
Okay.
And then finally, in terms of relieving the itching, focus on distraction, playing with toys, things like that. For
Yeah.
step one. Step two is rescue remedy,
I do that. We're doing that.
and put rescue remedy on your hand and pet her if she
Ah,
likes petting. That
she
kind
does.
of thing can certainly help.
Okay.
And then I think if you go to all those resources, that's step one. And we need to move on.
No problem. Thank
All
you. Thank
right.
you
You're
much.
welcome.
Appreciate it.
Yeah, and I'm just going to interrupt Linda. After you take the 101, if you could come back and or ask your questions again, that'd be great. But you're going to get a lot of suggestions in there.
Great. Thank you.
And yeah,
Because I've been meaning to do it and
Yep. Now make that a top priority.
I absolutely will. Thank you so much. Appreciate
And
it.
your second priority in terms of mind width for studying, and this is for everybody. If you haven't taken the 101 course, whether you're a member or not, take the 101 course. If you've got an issue and you're a member, retake the lesson that applies to the problem. And for you, Linda, look at the How to Find a Holistic Veterinarian.
Okay.
And that article and the websites are going to take you a little bit of time, so be patient with it. But
Okay.
just start moving in that direction so you're building your holistic healthcare team.
Okay. Great. Thank
Katie,
you.
you're up next.
Hi, good morning. Thank
Good
you.
morning.
Thanks for having me. This is the first time I've ever been to one of these, and I kind of got on your mailing list because of the conference that Jeff Grognet did.
Oh,
So,
yes, good.
yeah, so I just kind of have been tracking some of the things from there, and I noticed that, is this the right place? I think I saw on the marketing for this about I can ask things about separation anxiety. Is that accurate too?
Sure. Yep.
Okay. So I'm not a Holistic Action member, but we do recently have a new Shepherd mix dog. She is a rescue. She's about 2 years old, and brand new to our family. We already have another Shepherd mix too, so she's coming into our home with another dog. And she's definitely having a lot of separation anxiety. Like the first she's had to be in daycare the whole time since we've had her. We've had her about a month. And yeah, she just really has a lot of
Wait a minute.
challenges around that
So she's in daycare
because I can't leave her at home. I usually come home midday in my work day to walk my other dog. And for her, if I even have left the house, like just out the door,
what
even
does
if
she do?
she gets the first 2 days that we had her, she was like panicking, like terrified, panicking. My husband stayed inside the house and I just stepped outside the door, and she just went like complete terror.
And how do they say she does at daycare?
They just say she does fine. I think she she
Good. Well, that's
yeah.
really good. So at least you know that she's doing fine in daycare. Now, it could be she's suppressed. It might be good. Do they have videos there where you can watch the dogs while they're there?
They do not have video. I think
Okay.
they used to, but they don't any longer. And I think it's when she's with an adult, because since she's gotten used to my husband as well, like just initially, now she does fine if I leave the house. She'll kind of
Okay.
like cry a
Okay.
little bit and then do a, perimeter check, and then kind of cry, perimeter check, like so, but it isn't the way that it first was.
Well, patience is very key. Dr. Jeff, could you put the link to your article on you and Maya? So, Dr. Jeff has a very anxious hiding under the bed when he first got her dog that was super, super, super anxious and still has issues. And so you will learn a ton from that article. Okay.
Okay,
Number
great.
two is definitely take the 101 course.
Okay.
Number three is pay close attention. Try to learn to communicate, to hear. What's her name?
Shadow.
Shadow. Try to hear what Shadow is saying. So really pay attention, um, much more closer than you have, maybe.
Okay.
And think about you going to Burkina Faso, being dropped in Burkina Faso, where you don't speak the language and they're living in huts and the bathrooms are out behind a tree. And you need to go desperately to the bathroom and you've got to figure out how to do it and you don't speak the language. So imagine yourself in that situation. And that sometimes can help you get there. The other is looking to give her choices in everything that you possibly can.
Okay.
And the real key is just be experimenting, trying. The fact that she's happy at daycare, happy with at least one adult being around, you've got a good beginning. Um, you have time. It's not like super panic mode. And then I'd highly suggest, of course, joining Holistic Actions because you can post in the forum and we can give you a lot more answers. And we have over 7 years of webinars. Every year we've dealt with anxiety and multiple speakers on anxiety, which will give you all sorts of different possibilities. And then another is to think about flower essences. Just Rescue Remedy is excellent. Or if you go to jacksongalaxy.com, Dr. Hovey's made one that she thinks is Rescue Remedy on steroids called Stress. I'm drawing a blank, Dr. Jeff.
Stress stopper. Yep.
Stress Stopper.
Yeah.
And there are also other flower essences are totally safe, so you can play around with those all on your own. Okay?
Okay.
Is that a good beginning? And think about the diet. Take the 101 course.
Okay. Is there a can somebody post that in the chat, please? That would
Uh-huh.
I'm
okay.
working
Yep,
on links
he'll
right
pop
now.
that in
Yeah.
for you. And then the second, as I said to Linda, is go to the article holisticactions.com/select and then go to the forum. So select is finding a holistic vet that you can be working with. And there's so many different approaches. This dog will be doing great because you've made a great start. You're already doing so many right things.
Thanks, guys. Thank you
Yeah,
so
You're
I
much.
can make
welcome.
it. No, thank you, guys. Thanks for
Thanks for
adopting
being
me.
here.
Yeah.
And also, if you did Jeff Grognet's, he's done one or two summits on anxiety. Yeah,
Okay, yeah, I didn't see his. This was the first one I've ever seen. This past
Grab a
one about
drink.
the grief and loss. So, yeah, I'll look for his. I'll watch for his
good.
on anxiety too. Thank you so much.
Excellent, excellent. Okay, so Catherine in the chat um, is not an HA member yet, and her cat has either colon cancer and intussusception, so they assuming it's cancer. There's going to do an ultrasound. There's also peritonitis. Um, she's doing herbs and remedies for infection. He has lots of liver cysts and a cancer pattern and a large liver tumor. And so the allopathic vet thinks that surgery will not, he will thinks that surgery is not really an option. Um, so there's not basically what I can tell you is enjoy every moment, focus on happiness and quality of life, and anything that you know that your kitty loves. Does your kitty love to cuddle? Does your kitty like a catnip toy? Does your kitty like you to pet him or not like you to pet him? Does your kitty like a soft voice, a loud voice, music? Um, and in terms of treating your cat, the main possibility would be to be working with a homeopathic veterinarian. And I know that money is an issue for you. So you may want to not do a lot more diagnostic testing. You've already gotten enough to know that there are pretty serious problems going on. So I wouldn't spend your money there, but I would rather begin to work with a homeopathic veterinarian. And there are ones who can work virtually. But the most important thing is to be really staying focused and focusing on quality of life. Dr. Jeff, what would you add to this?
I have nothing to add yet. Can you remind me how far I need to scroll back?
It's the very beginning.
I don't guess they've already asked their questions.
Actually, after Daisha,
What's after dash? Okay.
after Jen, after Miyoko, and then it's Catherine Hargreaves.
Okay.
And Catherine, I'm going to let Jeff read that while I do a couple of quick other answers here. Oh, I love this. Jenny had neighbors and friends who brought fresh food over to her wonderful dog, Yuki. So that's great. So Daisha is noticing that if pumpkins added to the raw food diet, they have more robust poops. Yeah, it's fine to do that. I would vary food all the time. I would always be feeding different things and explore what makes them feel better. And so a raw diet, his whole life, he's had, again, be happy, and you know this. Daisha's a Holistic Actions member, be happy with that. And it certainly, you know, you could play around with the diet, flower essences. This might be one dye shift for talking with an animal communicator, and seeing what's going on in terms of if there is allergies or anxiety. Um, so I would give it a go with that. And why don't you post in the forum? I want to know a little bit more about what you're feeding and stuff like that. So if you'd post in the forum, that would be wonderful. And of course, flower essences are good too. And
Dr. Christina,
yeah,
this is Daisha. I just
yep.
wanted to ask, when you're asking about posting what the diet, do you mean for my friend? Or
Oh,
for,
this is a friend that has a
yeah, one is
19-year-old cat.
my first question was for my cats, which you answered. Thank you.
Oh, okay.
And then, well, the second question, I'll be really,
I
really
see.
fast,
Okay.
is that her cat is an indoor-outdoor cat, so it does eat, Eli does eat mice, he hunts and stuff. But she does feed him a raw diet, but I noticed for a little bit of flavor, she'll put like a cheaper canned food in, like just a
That's
little
okay.
bacon
That's
on
not
top.
gonna, that's very unlikely.
Okay,
And
yeah,
you could ask her to try some fresh food things that the cat might like on top, or
okay.
experiment with different foods. And you can certainly still post the question in the forum and see if she wants to join Holistic Actions.
Yes, thank you. Okay.
You're welcome.
Yeah,
Dr.
but
Jeff, back to
Disha,
Kath. Oh,
yeah, I just want to add in, Disha, feel free to post any of your friends'
yeah,
challenges.
absolutely.
That's why we're there.
Thanks. I'll also remind her that she can view the what people have posted on the forum. She just
Hmm.
can't post if she's not a member.
Yep.
Thanks.
For Catherine, Dr. Jeff, any
Yep.
more comments on
Oh gosh, many,
this
many,
very sick
many.
kitty?
Yeah, to the
Yes, but you're
very, very.
limited in time.
I know, and maybe I missed, but do we know how old the cat is, or what the cat's quality of life is? Because those are the two things that are gonna really determine the answer.
Right. Catherine, can you unmute yourself?
Yeah. So he's I think he was born in 2007. And so he's over 18. Um, let's see.
Yeah, and is he acting sick? What's his
Yeah.
beam like?
She doesn't know Beam.
Yeah,
Is
so
his behavior, energy?
so he wants to walk around. He seems to have high energy, but he's clearly in pain. And uh like he likes walking, but if I put him down to walk around, lately he's just been sitting there. He is rubbing his face.
Yeah, I think
Yeah,
we may have lost
definitely needs to
Catherine.
be working with a homeopath.
Yeah, and I
That's really
apologize.
about
I
it.
think we did lose Catherine, but what I was going to say is, I would, at this point, rather than do nothing, which I see the vet is recommending, and just waiting for him to die, yeah, you may want to decide if surgery is an option, and it may be surgery and euthanasia if they find, cancer all over the place. But if it's an inception that could theoretically be remediated, but an inception in an 18-year-old cat is often related to cancer. So sorry. Go ahead.
So, let's move on. Elise?
Hi, thanks. This is great. I wanted to ask about, I have a relatively newly rescued Havanese who just turned 8, and I've had him since July. And a lot of what you talked about with separation anxiety, the other person definitely applies to this guy as well. My most specific question about his anxiety, which well, I believe it's an anxiety symptom, but I'm trying to figure out whether it's also nutrient based as well as he eats fabric. And it is I basically would have to take all the fabric out of the house in order to prevent him from doing that, or have him wear a muzzle all the time. I mean, and I when I adopted him, I was given a bag of his toys and some clothing, and his toys were just incredibly just destroyed by chewing. So this is definitely not a new problem. It's not just new since he arrived with me, and he sometimes does have a few days in a row when he doesn't eat fabric, he passes it. It seems like he chews it in smallish pieces, and I mean, luckily so far he's passed it, and he eats raw food. He did not eat raw. He had a kind of crappy diet before, but anyway, his and I kind of make a slurry of it, so there's a lot of liquid so that it will help whatever he's eating to pass. I'm working with an
What,
animal communicator.
and
Uh,
what does the animal communicator say? Why is the fabric eating happening?
we're still trying to get at that. Um,
What about play, exercise, that kind of thing? You doing a lot of that?
yeah, he goes out. He well, we go out. I have two other dogs, another one that I also got around the same time, and then one I've had for longer. Um, And so he's out 3 or 4 times a day to play in the yard, and then we go for walks. Also, he is high energy. He has good appetite. He's generally in a good mood. And behaviorally, separation anxiety wise, um, new is that he won't let me out of the house. So I have to do, I'm going through all kinds of different machinations to escape.
So,
But
Elise, you've
yeah,
you're a member.
yes.
And so have you listened to all of our wonderful, especially the last couple of years? We have Brendan Goya's talk, I read Bloom's talk. I would definitely get Elizabeth Johnson's book. She spoke. And Elizabeth Johnson's book for everybody is, if you can put the title in, I forget what it is, Jeff, if you can look it up. The wonder, it's taking the Chinese medicine, metal, fire, etc., and showing how to identify what your dog what your dog is, and then how that can help you be with them in the best way. So I would definitely do that. And flower essences. But the
I've been
most,
using the stress. I use the stress stopper,
yeah,
and
you
I've
need to be more specific. I would work with your animal communicator on which one might be the best, which ones might be the best.
um,
And but really, I think the key thing is going to be for you to listen to the wonderful animal behavior people, especially since it's escalated to where he doesn't want you to get out. And in this short time, and post on the forum. We can definitely go in more detail on the forum.
okay. I had a
Okay.
dog like this before, and it did pass for her after a year or so, with various support. But yeah,
You're being given lots of chances to become an expert in this area, aren't you?
Mm.
well, and I'm also in Joan Rankeck um, uh, course now, her program,
Oh, good. Okay. Well,
station
then
program
then
too,
I
and
would start working immediately with
yeah.
you know with one of her people or with her as part of the course. You should be able
Yeah.
to get support.
Yes, we're doing that.
And and then
My most specific question was my concern is about the toxins that's in the fabric and how to, mitigate that.
okay,
Plus,
mitigating the toxins in the fabric is just like mitigating toxins that we're exposed to all the time. So feed the clean, do the cleanest water you can, feed the fresh food, do exercise, massage,
mhm,
um, maybe even, I don't know, you might want to talk to Julie at Adored Beast. Maybe even bathing and then replenishing the microbiome of the skin might help, but definitely plenty of microbiome work.
Yeah, I'm working on that, but that's a good idea to get in touch with her. Okay, thank you.
You are welcome. Renee, go ahead.
Hi there. Can you hear me? Oh,
I
great.
can. Yes,
Great.
very good.
So I have a 17-year-old female cat. She is still healthy and she has all of her faculties intact. For the past 4 months, she's been vocalizing intensely. Her vet has confirmed that there are no health issues. So this appears to be behavioral. We recently moved, okay, and I've been working, communicating with her about this transition. And I'm an animal communicator, and I'm still finding it challenging to understand what she needs from me and what the issue is. I use flower essences. I give her massage. We have playtime. I beside myself. She eats raw. So if you have any tips, I'm open.
Well, one tip just from many animal communicators over the last 45 years that I've worked with is often you can't do it with your own. And you have to contact one of your colleagues and have one of your colleagues work with them. It's just like
Okay.
surgeons don't operate on their own families. So that would be important. And again, step back and really pay attention to what she's saying and see if you can see what's happening just before the vocalization starts. And just before that, see what might be like a trigger to it. And also notice things like the position of the moon or other environmental things that might be going on, if there's any differences over time on that. And then finally, working with a homeopathic veterinarian can really help as well.
Okay.
And
And
I presume, Renee, that you know how to do muscle testing or get yes, no
Yeah.
answers. So use that. A lot of people forget to use that. So
Yeah.
go through, start working on that. Are you familiar with Paralandra and Medical Assistance Program, the MAP program?
No.
Okay, check that out. Michelle
Okay.
Small Wright. A lot of muscle testing and checking things she does,
Oh, okay.
and
Okay.
essences and things like that. Nice to add to your practice in general.
Right. Okay. All right. Well,
Dr.
thank
Jeff?
and,
you.
and yeah,
Good.
before we wind up, I may have missed it. When did your kitty have blood work last?
Mine?
Yeah.
Yeah.
Oh, I think it was about 6 months ago.
You know offhand what the T4 level was? Thyroid? Because hyperthyroidism causes or triggers that symptom that you're describing in a
The
lot of older
vocalizing?
cats. Yeah, yeah.
Hmm.
Yeah, if
I
they just ran a screening T4 and it was marginal, then ask them to run a free
That's a
T4.
good point.
okay.
And also, how's
Okay.
your kitty's hearing? 'Cause a lot of cats
Oh,
vocalize at night and they don't hear, so they are losing the hearing.
she can hear. She is a hoot. She is present. She can hear. Um, so and it could be that she's mirroring something within me. So
Yes.
I'm looking at that as
Yeah.
well. Yeah.
Make sure that she knows that you hear her.
Yes. Thank you. Yes, I do. It's like even when I don't, I tell her, kid, I'm not hearing you right now. Give me a minute. Then we reconnect.
Great.
And yeah, so I think, because she's my girl, I think I got it figured out, and then I don't.
Yeah.
So yeah, I do have to reach out to somebody else to connect with her to get more information.
Wonderful. That's
Thank you.
that's a few. Yes,
Okay.
Jen
Yeah.
Bridwell also commented how it's hard for her to do energy work on her own animals.
Ah,
Yeah,
okay.
and
So
it's
it
Yeah.
it's funny because my appointment right before this, they're working on building up their telepathic skills, and what Michelle said is, I love the way she put it, that it's too much static. There's too much static in your mind, too much worry about your own animals to hear clearly what you need to hear.
Yeah,
So yeah.
absolutely.
Thank you.
So Lily, can you unmute yourself?
Hi, how are you?
Hi, very good.
Hi.
Are you a member of Holistic Actions?
I have been in the past,
Okay.
but now I just go and I kind of read the forums and stuff. So,
Okay, well, you know how to do that.
yeah.
So, it seems to me that you have not yet put together a holistic healthcare team.
No, I haven't. I haven't. But
Great.
this is my sister's dog, and I
Okay.
thought I would ask. Got
Okay.
inflammation in the eye, and they gave her drops, but she didn't use them, and the inflammation increased. So now she's on prednisone and steroid drops, and the dog's in a lot of pain. And the vet said if the inflammation had increased, and if it did increase, they were going to remove the eye. So I just thought, do you have any suggestions?
Get a holistic vet.
But
I mean, really, this is why everybody, and some of you are new here, so I just want to reiterate what I said at the beginning is step one is do the 101 course. Step two is create your holistic veterinary team. And that's the article, holisticactions.com/select. And where do you live, Lily? Or where does your friend live?
in Maryland,
Where in Maryland?
Frederick, Maryland.
Okay. So in Frederick, Maryland, hang on, make sure you're here till the end. I'll come up with there's
Okay.
a person or two in the Frederick area. Oh yeah, it's not in Frederick, it's in Mount Airy. And I'm
Okay.
pretty sure it's the Mount Airy Veterinary Clinic.
Okay.
And they do Chinese medicine. And
Okay.
they've been doing this for a long time.
Okay. All right.
So check that out. And and I may come up with another one for you.
Okay.
I'll make a note here.
Okay. Can I ask you one other question?
Mm-hmm.
What would help with a 12-year-old that is spayed but has vaginitis? And I know there's some homeopathic remedies that they have created, but I contacted a homeopathic person, but she hasn't gotten back to me because she's so busy. But there's supposed to be some no-sods that help with that. Any
Dr. Jeff and I really believe that homeopathy needs to be done treating the whole animal
Okay.
and not treating a problem.
Okay.
Now, if there's an acute trauma, yeah, try arnica,
Yeah.
or if there's an acute this or that. But I'd rather you be using a calendula flush. I would stick with some herbals, or get your homeopathic vet.
It's kind of funny. It's kind of funny you said calendula because I did a warm compress with fresh calendula flowers for her.
And
Great.
did that help a little bit?
It did. So I just need to keep it up for 3 times a day, and yeah,
Well, yes. And she's 12 years old.
and scoots every day. Yes.
She's 12 years old, and therefore, this is your wake-up call, Lily.
Okay.
Okay? Because you can treat this with herbs and that with herbs, and then something else happens, and then something else happens. And
Right.
this is why people say, when my dog gets older, they just get a lot more problems. No, it is not the passage of time for
Okay.
any of us.
Okay.
It's the fact that we have not balanced the energy field, as Dr. Jeff talked about at the beginning.
Okay.
And the ways to create balance in the energy field is with all the different holistic things you can do yourself with fresh food diet, etc. But
Right.
once a symptom appears, then it's better if you can treat that deeply with a homeopathic veterinarian or a Chinese, really good Chinese medicine veterinarian, either one.
Okay.
So this is your wake-up call.
Do you know of one in Virginia?
Go to there definitely are some.
Okay.
Go to the select article.
Okay.
And read the whole article, follow all the websites, and you should come up with one. And homeopathic veterinarians can work by phone. And for everybody, if you're a Holistic Actions member, Dr. Jeff has a separate part. He does Holistic Actions and he has a veterinary practice of homeopathy if you're a Holistic Actions member. For me, it doesn't matter if you're a Holistic Actions member or not. I do Holistic Actions and I have a consulting practice. I'm not treating animals with homeopathy anymore, but I'm helping walk you through all the things like we're talking about today.
Okay.
So if you need more help in finding a vet or what's next or what can I do right now to help with the separation anxiety or a cat with cancer, things like that, I can help guide you. Sort of I'm a guider.
Okay. All right.
And in terms of the eye, the only thing I would add in right away that you probably have on hand would be rescue remedy or stress stopper.
Okay.
And that would be good. And then talk to your friend about not being panicky
Okay.
and having positive thoughts and loving and finding out like when she seems just all day long, the happiness protocol. You can share the happiness protocol with her.
Okay.
That
All
would be a good one.
All right.
Anything else on that one, Dr. Jeff?
No, just the direction you were going in, and that is, with all these individual separate problems and individual in different animals, we just always have to realize that they're doing the best they can. They really are doing the best they can, and that symptoms are just the way of their body trying to communicate with us.
Yeah.
And that, if you focus on love and joy, that the symptoms will go away. If they're meant to go away.
Okay. All right. How do you keep the eyes healthy just in general?
The same way you keep the skin healthy, the liver healthy, the bladder healthy, you feed a species appropriate diet, and there is no one right answer, just like there's not for people. You exercise, you keep them happy, you listen to them, you pay attention to what makes them happy, you massage them, you learn acupressure, you learn energy healing that you offer yourself every day.
Right.
All of the above.
Yeah, I have one positive thing to tell you. I've been dealing with inflammation in my eyes for 15 years. And my husband had a health issue. And Brooke Goldner popped up on my phone. It said the green smoothie for like protein in the urine. So I started doing the green smoothie drink. Then I went to my eye doctor and had an update. He looked at my eye. He said, Lily, no inflammation. I said, are you kidding me? And all I did was I started doing kale smoothies. I changed my diet and it totally took care of the inflammation. So
see that, and now here's the thing for everybody who heard that. 5 people with the same symptoms could try the smoothie. And for 3 or 4 of them, it would help the inflammation in the eye. And for 1 or 2 of them, it wouldn't help the inflammation in the eye because we each need something different. But the key is you're doing your best when you keep trying different things and listening to the universe when they say, hey, try this.
Yeah.
And then you try it and it either works or doesn't. And good for you. I bet that's a big relief.
Yeah. And the biggest thing was that you guys suggested a symptom log.
Yeah.
Is powerful because I do it daily and I make notes and I listen to that, and I write the symptoms down. That has been the greatest help.
Excellent. So for everybody, those of you who are members, it's a member benefit to download the Healthy Dog ebook or the Healthy Cat ebook. For those of you who are going to become a member after being on this call, have that be one of the first things you do and get started on that because it helps guide you through doing it as easily as possible. Dr. Jeff, we've got a question that I think is a good, Miyoko's asking about recommending vital force, vital defense at Adored Beast and using it on one, dose it for 1 month, 3 times a year, which is what Julie suggests. And it's a question we all have. What what things should we be doing always? Is there something? And what about, do you use that preventatively, or do you wait until there's something showing a few little clues of symptoms? Go ahead.
It's funny you asked, since I was just thinking about that this morning, when I was thinking about the fact that I have not used any supplements at all, really, with Maya or myself. And yeah, the answer is I think you gotta first start by nurturing your body, because all the supplements in the world are gonna work by your body doing its job. Now, supplements just help the body do its job. And yes, I think that in this toxic world, 2 or 3 courses of vital defense or E60 or QMax or, other antioxidants, it's not a bad idea. I myself used to be on grapeseed extract a couple times a year because years ago, and I haven't done the research recently, that grapeseed extract was one of the most powerful antioxidants out there. But, at this point, vitamin C, high dose vitamin C, along with fiber, because what they're finding is the best way to get the body to detox through the colon, and fiber maybe or is the top way to detox the body. Yeah, I usually combine the vitamin C and the fiber a couple times a year. And actually, for dogs, anytime, or cats, anytime they get a vaccine or other stressor.
So again, there's no one right answer, but it's wonderful to keep listening to what each person does.
Hmm.
And then you try it and you see how, do you feel better doing one thing or another? And speaking of vitamin C, Jen was asking about um, vitamin C being used IV to treat osteosarcoma and many other many other things. And the difference between the vitamin C IV at these super high doses and giving it orally is that the oral does not seem to come close to matching the IV vitamin C. But you need to be working with a veterinarian who's believes in that, uses that, has done it as part of a protocol. I know when I worked for Dr. Carvel Tiekert, who was the founder of the American Holistic Veterinary Association, he only used it in certain cases of cancer and not in all cases of cancer. And there were other times that he used it this was 1988. So I can't remember, unfortunately, exactly what he did. But there is a lot in the literature about that and veterinarians that are working in that area.
And I'm going to ask you to address Josh's question about fleas at some point, but I first want to say that I don't know of any studies that document that oral versus IV difference. In my mind, the difference is the dose. It's really hard to work up to a dose above 4 grams, 5 grams, 6 grams, 7 grams orally, and they get, diarrhea, they get nauseous, they get sick. But if you're able to do it, it's worth it. It's worth
Even with
trying.
the liposomal vitamin C.
I, again, don't know any evidence that any one brand works better than any other one. The one that we put together is just with the one that Linus Pauling, Nobel Prize winner Linus Pauling, won the Nobel Prize for vitamin C. That was the same one that he used. So
Okay.
vitamin C is vitamin C. Tasha was just asking about susceptibility to fleas.
Ooh, I missed that one.
Well,
Before we leave vitamin C, though, Catherine asked about the very last post, PERQUEC. I'm not familiar with it.
don't know it. Yeah.
Sorry. We're
look
not
it up.
familiar
Yep,
with that
yep.
one.
While you answer it, I'll look it up.
Well, I have to find. So asking about
1247.
susceptibility, what'd you say?
1247 is when
Oh, okay. Oh, I see. Oh, that's a way to tell it, isn't it? Okay. Oh, um, so susceptibility. Um, when, so you're saying that readings that you've had say that he's super healthy, his beam is great, you're feeding fresh food, he's 4 years old, and yet he still has been getting fleas. Well, now, first off, you said we can't get rid of them quickly. And you've read the Fleas Be Gone for Everybody is a book on Tasha, why don't if you can unmute yourself, you can, that's fine. Isn't it a joy today, everybody? We don't have as many people and we can spend a little more time with each person. Um,
Hi there, can you hear me?
yes, yes, we can hear you.
Yeah, so in the
Um,
past when he got them, we were able to, we just give him a bath and they'd be gone. The last few months, he's got tons of them and we keep doing all of the stuff. Um,
what have you
but
done?
um, so we're feeding him a bunch of things that are supposed to be anti-fleas like garlic and neem and various herbs and stuff. And he's
Mhm.
on like super healthy diet and everything. Um, and that so then we're giving him natural, with flea shampoo, natural flea shampoo. And then we're combing it out to get them out. What else are we doing? We thought about doing there's a nematodes, but there's grass everywhere here, so that we can't really treat the whole area. That wouldn't really be.
How large an area
Um,
is it?
oh, I mean, because where he walks, it's huge. I mean, it's several, so there's
But does
this.
he spend often what people find is that if their dogs spend a lot of time in their yard, even though they're
He doesn't.
walking
Yeah,
miles and miles.
he doesn't spend, we don't have that kind of space. So yeah, it's more just
Okay.
walking him. Yeah, so that's not really viable. Um,
Well, you still may want to do it. The flea destroyers, nematodes, are actually bringing your soil back into balance. They seem to be the best batch of nematodes that are out there, and you just do it one time a year. So it might be worth giving it a go, given what's going on. Because if you're sure that there are no fleas near the house, that that helps, because otherwise they can come in. And have you tried the ultrasonic flea tag or the EMF flea tag?
we haven't tried that yet, no. But
Okay,
I wondered if it's a sign that he's imbalanced, given that, you know,
well,
he's never had this
normally,
before.
normally it is. Um, but when it's the only thing that there is getting tons of fleas, sometimes I wonder if there's something they're getting into. I had an indoor outdoor cat, absolutely never had a flea on him. And one day I was petting him, and all of a sudden I practically screamed. He was solid flea dirt, solid from head to tail. And I petted him every day. I mean, I might have missed a day or two, but it certainly wasn't very long. And he must have crawled into a fox den or something. And he was just covered with fleas. However, he was healthy enough that I flea combed him outside for about 3 hours off and on. And then for the next 4 or 5 days, flea combed him, and they got less and less and less. And I put up flea traps in the house. Ooh, that's the other thing to do. A
Yeah,
bowl
we've
of
tried those.
soapy water. You've done that?
Yeah.
Okay, and are you getting fleas in the flea traps?
No, we didn't get any in the flea traps.
And yet he has a lot of fleas.
Yeah, he has a lot of fleas on him. I know, it's weird. We never had it like this before. I don't know what's going on.
Well, in the meantime, and there are no other symptoms. He has
Oh,
no
it's great.
other
No, he's
Nothing
great.
else.
No signs at all. He's great.
That's when I wonder sometimes. Another one that you might want to try, since I'm not sure, as a homeopath, I'm not sure there's anything there to treat, to get him back to being balanced. I mean, other than skin, what is it? Skin something. There's a rubric for that. But you could try Green Hope Essences has a flea-free, FLEE free flower essence. And she recommends using it energetically, putting a drop or two in your hands and just petting the dog and going, fleas, I know you belong on our planet. I love you, fleas. And we need to have you not be on our dog. Spritz the outdoors and say, stay away from my dog. Spritz a little bit before you go on a walk. Put a couple of drops into water. Spritz before you go on a walk and just visualize not a single flea hopping on.
Okay.
This is
Great,
giving you a
thank you.
few other ways to be
Yeah,
thinking
thank
about
you.
it. Dr. Jeff?
When it comes to fleas, I, say just live with them unless they're really, really
Sounds like too many
infesting. And
here.
yeah, infesting, in which case, if you've done everything else, two of the things I would do is really work with somebody that can look and see if there are any early warning signs. Would be, inroads for homeopathy. And the other would be conventional, and that is if your dog is uncomfortable, you may want to try like a flea birth control, where at least there won't be any fleas living in the environment. I don't know if you're in a warm environment where, if you're in Florida, it's not going to work.
But she's not getting any in the house in the flea traps, so
That doesn't mean
sounds
that they're
like
not
there are
in the
not that
house.
many
Yeah,
around.
yeah.
Well, it gives you a
Well,
few. I'm
yeah,
sorry.
thank you so much. I appreciate it. What's the flea birth control? That's a chemical, is it?
Yeah, it's a chemical.
Okay,
Which
thank you.
what's the
It's
brand name
called
of that?
lufeneron. It's the name of the name
He'll
of
put it in. He'll put it into the chat for you.
Awesome. Thanks so much. Thank you very much.
And here's the other thing. Sometimes in 40 years of practice, there were 3 times where we resorted to one dose of Capstar or one of the chemical flea, getting rid of the fleas. And it was people who had just done everything that we couldn't come up with anything else to do. And their dog was absolutely seemed to be healthy in every other way. And 1 or 2 doses, and then everything was fine. And I mean, we are being poisoned all the time a little bit. So sometimes giving a poison like that one time, and then continuing with everything else may also be the way to go.
As long as there's no source. 'Cause if there's a source of
Right.
reinfection, then yeah, then that's the rationale behind keeping it over and over again because you're ignoring the underlying problem. But yeah, so yes, but I agree. A dose or two of Capstar is fine in most situations
Yep.
as long as there is no source.
Right.
Capsar is the one. Is
Yeah,
that one of the 24-hour ones, or is that a longer?
no, that's a one-shot deal. It's not
Okay.
like the Lufeneron. It's not like the flea birth control, which does last for a month. But it
Okay.
doesn't kill anything. The reason I like it is it's not that toxic. It doesn't kill. It just keeps the fleas from reproducing.
Okay, great. Thank you.
All right, and
And thank you, Daisha, for commenting about how your kitty picks up on your emotions. That's a great example. There's enough in this chat. I wonder if we should send this chat when we send our email around.
Well, we'll figure it out. My play date's been sitting outside waiting for a little bit,
Oh,
so
we hit our
we're gonna
time. I
run.
missed
Yep,
it.
we're gonna
I
run. We're
missed
gonna
it.
run.
Okay.
See you guys at the end of the year. Hard to believe that this will be the end of 2025, but we'll see you in a month. Or if you remember, we'll see you on Monday when we talk about quality of life. This is quality of life month in holistic action.
And any of you that are members with kitty cats, we're going to be having an incredible history of the cat and behavior of the cat on our second Monday with Jonathan Losos, who's written several wonderful books.
And speaking about books, anyone that's
Yes.
pre-ordered the book, the ebook is now available, so everybody here could read it by next month. So you won't have to say anything.
And they're all sorts of
nobody will show up.
they'll still have questions,
Right.
but you'll be on the path to wellness.
Well,
So definitely, and if you sign up to if you pre-order it, there are all sorts of extra benefits you get, and you'll get notices of Dr. Jeff's fireside chats. He's got a couple more of those coming up in the next 2 months.
all right. So
Glad you
thank you
did that,
all.
Jeff. Thank
You.
you.
Yeah, I almost forgot. And have a good
Too.
holiday, everyone. And we will see you after Christmas. Bye.